Hello, my name is Kirsten Bibbins-Domingo. I'm professor and chair of the Department of Epidemiology and Biostatistics at the University of California, San Francisco. I'm also the vice dean for Population Health and Health Equity at the School of Medicine. I'm one of the two co-chairs for the Roundtable for Population Health Improvement, the Roundtable on Population Health Improvement, housed within the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine. I welcome our virtual audience today and those who are viewing the recorded webcast of the workshop titled Community-Led Initiatives for Population Health Improvement. Our Roundtable recognizes that health and quality of life for all are shaped by interdependent historical and contemporary social, political, economic, environmental, genetic, behavioral, and healthcare factors. Therefore, the Roundtable seeks to provoke and catalyze urgently needed multi-sector community-engaged collaborative action. In regards to today's workshop, we know that community leadership, voice, and power are essential drivers of successful population health efforts. In a relatively short amount of time, the field of population health has been able to move its discussion about the role and potential of the community as a participant in population health efforts to acknowledging that, in fact, the community is and should be the leader and driver of these efforts. In order to lead, the community must exercise its power, as power is the driver to influence all social drivers of health. Power is wielded to shape those factors that shape our lives. Although this realization is certainly not a new one, and neither is the notion that community power shapes community well-being, the spaces where multi-sector lines of inquiry and conversation about power can take place are still limited. The Workshop Planning Committee has invited experts with professional and lived experiences in these types of efforts to share their perspectives, knowledge, and wisdom. Importantly, we regard scientific research and evidence on par with lived experiences and narratives as fundamental and complementary tools for supporting community power. And as you will see, the agenda reflects that sentiment. Moreover, collective power is built by and through relationships. And throughout the workshop, you will hear how important these are. And at the end of the event, some of you have the chance to participate in a tried and true exercise used by community organizers. Overall, we anticipate that the combined contribution of our speakers will render a well-rounded initial workshop that will help us and the audience understand the bridge between population health and community power. Let me reiterate that Roundtable and Planning Committee members acknowledge that the efforts being carried out in communities and by communities are not new. What is new is the heightened and simultaneous attention that the community and its power are receiving from so many other sectors, public and private alike, which further highlight the need for forums and spaces where these discussions can be held. Please note that in the limited time we have for the workshop, it is not possible to address all angles of this topic. We invite you to join us in June when the topic of civic engagement, another manifestation of community power, will be discussed at length as a part of this ongoing conversation. I would now like to express our gratitude to the Workshop Planning Committee. We thank Gary Gunderson from Wake Forest Baptist Medical Center and Wake Forest University School of Divinity, Lourdes Rodriguez from St. David's Foundation, Irvin Singal from the University of Texas, El Paso, Aditi Vaidia from Robert Wood Johnson Foundation, and Han Kayo-Yu from the California Endowment. Please refer to the attendee packet on our event page to view their very impressive bios. We also thank the Roundtable's staff, Carla Alvarado, Alina Bachu, Harika Dyer, and Asia Coltrane for their support. Let me say a few words about the organization of this two-day workshop. Today, we will hold 4 one-hour agenda sessions, and tomorrow, we will hold 2 90-minute sessions and an interactive activity at the end of the day. Today, we begin by hearing from 2 inspirational exemplars and embodiments of power. As women, as community leaders, as individuals, we are honored to hear from I-Jen Hu and Latasha Brown, who lead 2 great efforts that contribute to the health and well-being of so many. The second session of the workshop will be a discussion about community power in the context of population health improvement. After a break, the third session will highlight 3 approaches and frameworks used and implemented to support and leverage community power. Today's last session will explore how organizational and sector allies can support grassroots communities to organize their long-term agendas, and what data, information, research, or tools are effective in advancing community power building efforts led by low-income and Black, Indigenous, and people of color communities. Tomorrow's sessions will open up with transformative narratives of community-led initiatives, and we will hear about efforts from around the empirical evidence base that links community power with health equity outcomes. Before we begin, please note that the space below your webcast screen where you can submit your questions. Please enter your name and affiliation. Moderators will pose audience questions as time permits throughout the Q&A sessions. And now it is my great pleasure to introduce Tony Iton, Senior Vice President for Healthy Communities at the California Endowment, who will start us off.